Okay, next question, Dr. Hang. So people refer to traditional orthodontics as extraction and retraction. However, modes of treatment other than extraction and retraction have been around since the early 1900s, and like the Crozat and the Schwartz and different types of expansion. And there are many journals that go back to those times in which a practitioner describes extractions as having a terrible impact on facial form and encourages widening of the arches to promote nasal breathing. This is going back to 1915. And I've
Right.
heard of these practitioners as being called expansionists. So given this, is there really such thing as traditional orthodontists? Or is it the case that the industry has been divided into camps over the past 100 years and no one camp can claim the title of being traditional?
I think there are lots of camps in the profession. There's been an extraction, non-extraction debate that's been going on for, over 100 years. And I've read the literature back into those times when I was an orthodontic resident. I read all those journal articles way back into the early 1900s just because I wanted to know the history of the profession. So I know that it was a very acrimonious thing. They used to have very heated debates about this, and it really hasn't changed. From my perspective, the extraction retraction argument is a stupid one. It's an inane one. We ought to be talking about what does the treatment do to the airway. If we look at what the treatment does to the airway, then we're never going to be extracting and retracting, because I think that you're going to be reducing the tongue space in the airway. And so I think the benchmark, the measure should be, what does your treatment do for the airway? And we should have a goal of the treatment that it would, for sure, the least thing is that it would not make the airway any worse. And ideally, taking these young children who have small airways that are too small to begin with, that we might optimize their airway and dramatically increase it. Which is what we are able to do with orthotropics. We've even taken children who have sleep apnea at age 5, and by developing their jaws forward, we've eliminated the sleep apnea for individuals, and it's a huge thing. So I think we need to get away from the personalities in the profession that are so strong, and it's talking about various techniques and talk about correcting rest oral posture, helping kids to have their teeth together, their tongue to the palate, their lips together, breathe through their nose, so that their faces are going to go forward. And instead of talking about various ways to who's got the best technique to get the teeth straightest the fastest. Ignore the teeth, look at the face, look at the airway, and the teeth will come along for the ride, and we'll be happy with the smiles that we end up with. That's been my experience.
Bill, Dr. Hang, what causes us to have camps in the orthodontic industry? Is it big personalities, or is it the profession? Is it data? What do you think is the cause?
What causes us to have camps like that?
Why do we have these different camps? Why aren't people just saying, okay, let's just do what's reasonable, and let's look at the health of the patient? And obviously, if you look at one camp, extractions, people who don't do extractions and don't retract, they're concerned for the health of the patient.
It's very hard for me to know why there are so many camps. We in the last decade, last 15 years for sure, we've talked about evidence-based. Everything in the profession needs to be evidence-based. And certainly we want it to be that way. If you really look at what is written in all the journals about what does it take to be evidence-based, you'll see that most of what's done in dentistry, and this is a direct quote out of the Journal of the American Dental Association from several years ago, most of what's done in dentistry is not evidence-based. And you can get into lengthy discussions about why that is and how hard it is to be really evidence-based. So it's been traditional that people just follow the strong personalities and they don't ask the hard questions. They talk in orthodontic training about teaching critical thinking skills. Well, that would be a lovely thing, but no one sits there and says, well, why, Dr. Such and Such, are we doing this? Well, the answer usually is because we've always done it this way. I mean, I was told to take out teeth for my wife, and I didn't do that 32 years ago. And we were married for 11 years, and I didn't straighten her teeth because I knew I had to take out teeth based on what I'd learned. Finally, I threw caution to the wind, aligned her teeth without removing any. And everyone comes into my office, and she's my treatment coordinator. They look at her, say, I want to have teeth like hers. And her teeth look great. She doesn't have recession, and she looks great. The point is, people are taught to do what they were taught to do by someone who never tried it another way.
Okay. Thank you.